On this episode of the podcast, I have with me Sunil Mallya. He is the Vice President of Engineering at OncoHealth. We're going to be talking about how it's different to manage an engineering team in the healthcare industry. Obviously, some unique challenges, some constraints the team has to deal with. Sunil has a extensive background in the space, and I'm sure he's going to have some great examples to share. Sunil, thanks for being on the podcast.
Thank you so much for having me, Amir. It's great to be here.
Awesome. Thank you. I guess let's start off at the top. I like to start off to understand, what does OncoHealth do? And then secondly, as the Vice President of Engineering, what are some of your responsibilities?
Awesome. So let me start off with what we do, right? So OncoHealth is a digital health company, and we provide digital health solutions that reduce the physical, mental, and physical toll of cancer for everybody involved, right? So there are, as Vice President of Engineering here at OncoHealth, I oversee a delivery for 3 of our digital health solutions, and each targeting like certain specific areas, right, within the oncology domain. So there are 2 big ones, right? So there is one solution that we do for prior authorization, which is basically look at cancer cases that come to us and see evaluate the treatment plan that is being given and see if it is the right thing to do for the patient. So we look at other stuff like to see if there are maybe cheaper in-network providers that the patients could go to, right, to save some costs and stuff like that. But that is one of the key platforms that I own delivery for. And the other one, which is very exciting, is we recently launched a telehealth solution, a telehealth service for cancer patients to manage the mental health and physical side effects of cancer. It's called IRIS. So it launched in June, and that is pretty exciting. I oversee delivery for that solution as well.
Awesome. So lots of stuff, lots of activity. I like that. And I know you have a background, you have a pretty deep background in health. And the topic we're going to be chatting about is some of the differences. Actually managing a team and delivery within the healthcare industry is a little bit different. And I think, with your background, I think you'll have great insights. At the highest level, maybe you could just kind of give us a little understanding of what your team is made of in terms of, who do you manage? Are they all software engineers? Are you matrix? Just to understand some context.
Yeah, sure. So I mainly manage a team of software engineers, right? And the way we have structured is them into feature teams, right? So we have, for each product, right, we have anywhere between 1 to 3 feature teams, which work on delivery for the product, right? So all the software engineers report into me, and that is how we are kind of structured. We follow the agile release process, like most folks do, and we have like 15-day sprints, and we release usually on a cadence, like every 15 days into production.
Awesome. I guess maybe help us understand, in terms of when we talk about managing an engineering team in the healthcare industry. Let's say I know nothing of the healthcare industry. What are some of the things that stand out? Some of the key challenges that you're like, if you've never been in the healthcare industry, obviously maybe you're senior IC or manager, but these are some of the things you see every day, or just some of the common challenges at the highest level.
Yeah, I think one of the key challenges, right, is that you're dealing with sensitive information, right? Here you are dealing mostly with sensitive personal healthcare information of, especially cancer patients. So there are certain data access restrictions that our customers, and in general, we have to follow HIPAA regulations as well, which means that the data has to be stored, transmitted, and accessed in a certain way, right? And there are additional contractual restrictions that the customers might put in place, which prevents us from, for example, contracting workers outside of the US, right? So those are certain restrictions that we have to deal with. So we have to ensure that, if we have offshore team members working with us, and, those folks cannot have access to PHI data. So that means that, you have to put some kind of a re-identification process in place to ensure that those folks don't get to see the US, US-based customer data. So those are certain challenges, right? So that prevents us from leveraging offshore resources to do any troubleshooting or any production-related issues. So if a large part of your team is based out based out of the US, then it becomes a problem. But so as a director or as a VP, you have to make sure that you have adequate staffing in place in the US, right, to cover for all of those scenarios, right, to look at production issues and all that. The other challenges that we see is that some of the software that we use to process PHI, like for example, let's say if we want to make automated outbound calls, right, and then we want to use a third party vendor, to do that. Then we want to, we cannot just pick and choose any vendor, right? So we have to make sure that the vendor that we choose is HIPAA eligible and is HIPAA compliant with all of those regulations, right? So there are certain regulations that HIPAA puts in place, right? The data has to be encrypted, for example, right? It has to be located within the US. The servers have to be located in the US. The call centers have to be within the US, right? So there are certain restrictions that that customers and HIPAA regulations would want us to adhere to. So whenever we pick and choose a software or a third-party vendor, we have to ensure that that is done as well. So those are at least a couple of examples that I can think of, right, which are right out of the top of my mind. One more thing that I would also say is there are state regulations, right, in addition to, maybe we can cover that later, I think, the state regulation as a part of FDA regulation. That is okay.
Absolutely. I guess something interesting you mentioned there about staffing on teams. Obviously, some of your options, they're a little bit more limited. If you were not within the healthcare space, you didn't have to worry about PHI, HIPAA. You obviously have a little bit more flexibility when you're planning out your team's delivery capacity. Obviously, you know these going into it. How do you plan around knowing that you need to, like, if you needed to, spin up help quickly, that offshoring isn't an answer? Like, how is that taken into account?
Yeah, so what we do when we go into sprint planning is to reserve a part of the capacity for production support and, bug fixes and in general, as a tech reserve, right? So usually some of our onshore members, what we do is we take 20% of their capacity every sprint and reserve it. Because we always know that there will be something that comes up in production, or there is sometimes a need for us to quickly react and maybe design something very quickly. So it makes sense for us to park a little bit of capacity for that, because if we don't do that, right, then there's a chance that people can get burnt out very quickly, because if they have to do 100% of their work plus do help us with product support and other stuff, then it becomes a bit of a challenge. So just planning around that is really, really helpful.
Absolutely. And when you meant, so I guess if you're looking at that, trying to hold back, some of that capacity, production issues, when you're going through, your agile process, you said every 15 days, and you're looking at delivery, knowing that capacity is there, when you're talking to stakeholders, you have, 20% less potential output. When you're talking to stakeholders, is that, how do you help make sure they understand, obviously, like, hey, we're going to deliver, but it's not like my team can be fully devoted. We have a 20% overhead to kind of deal with some of those production issues, because obviously you have some limitations. Like, is that a conversation with your stakeholders, or is it kind of transparent to them, and it kind of doesn't factor into any of the the planning for them?
Yeah, it is fairly transparent. So we make sure that it is a part of the board, right? So there is either Jira or Azure DevOps, whatever your folks are. So we put that on the board, right, as a tech reserve, and there are planned activities, right, as a part which are identified and put on the board. There are certain stories. What we do is we tag them as stretch, right, which basically means that if we have the capacity, then we are going to get to it and do it. But let's say something happens in production, and then we need to, react and spend more time troubleshooting and debugging those issues. Then some of the stretch stories will not make it basically to the sprint. So it is very transparent. So at the beginning of the sprint, it is very clear on what our committed items are versus what the stretch items are. So that is how we make it transparent.
Got it. I guess when it comes to your specific agile process. Do you see, is any of the part of the process kind of adopted to account for being within the healthcare industry, or is it, pretty true to, let's say if it's Scrum, are you guys pretty true to most of the Scrum tenets?
Yeah, we are mostly true to the Scrum tenets. It's not really specific to healthcare.
So I guess in terms of vendor selection, you obviously have some limitations of who you could pick. Like when you guys are selecting a vendor, and you also have state regulations you mentioned, obviously that's adding a little bit more complexity. How does that variable of making sure a vendor, is HIPAA compliant, but also you have the state regulations, when you guys are evaluating that, is that more on the vendor to make sure then at that point they're all, figured out the states as well? Or is it actually falls back on you and your team to make sure both those aspects are lined up?
So the vendor part is separate, right, from the state regulations, right? So the state regulations are maybe certain laws or regulations that are passed by certain states, right? And usually we develop custom software for that. Like they might say the state of Texas might come up and say we have this new rule, which means that this set of drugs, have to be automatically approved, or just as an example. Then that is custom software on our side, which we would develop. As far as the vendor selection goes, right, vendors would normally mark whether their software or their service is HIPAA eligible or not. Right. Just to give you an example, Twilio, right, which is one of the telecommunications provider, we just cannot go there and pick any of their APIs and start developing healthcare solutions on that. They have marked certain specific APIs as being APIs or services that they provide as being HIPAA eligible, and we have to make sure that it is on us basically to ensure that we pick and choose only those APIs or services which are HIPAA eligible. And usually what vendors also do is they charge us a premium, since they have to provide all of those additional security layers, right, as a part of the to make the services HIPAA eligible. They normally charge us a premium. So for example, Twilio charges us like a security edition. They have something called a security edition where they charge an additional amount on top of what they would maybe charge a normal customer to ensure HIPAA eligibility and compliance for us.
Well, that adds to some of your complexity. I guess when I was just listening to that, and I'm thinking through, you mentioned early on third-party vendor selection isn't as straightforward. You have a subset you can pick from, and then obviously I know you mentioned state regulations and vendor selection don't always overlap because some of that might be custom. But when you're looking at third parties, and all of a sudden, you're looking at the options you have, does build versus buy come into play at some instances where you're like, hey, I just think the subset is not a fit? Obviously, in Twilio's case, APIs might be common, but how often does build versus buy come into play because you might not have as many vendors to select from?
Yeah, so sometimes what happens is a vendor might have a really good solution, right? But if it is not HIPAA eligible, that means that we cannot use it for our development needs. And then you look at, there could be other solutions, right, which are provided by, let's say, other vendors, which may not be as good, but are HIPAA eligible, right? So sometimes you have to go with not the very best solution, right, that is available from third parties. The other option, obviously, like you said, is to build it, right? So those are tough choices, right? And usually what we have seen is some of the top tier vendors, like take Microsoft, Twilio, etc. When the first version of the solutions normally come out, they don't come out as being HIPAA eligible, right? So now let's say there's something very cool that has come out. Normally, it is not HIPAA eligible until it reaches a certain level of maturity. And so it becomes a little hard for us to develop, something cool, cutting edge, right? If it is not HIPAA eligible.
Yeah, I guess somebody. I mean, I don't have a healthcare background, so some of this is interesting to me because I'm listening, and healthcare industry is a massive market. it's ginormous. I don't know how big it is monetarily, but it is enormous. And I'm thinking, you're here building solutions that are integral, they're important, and then you're telling me sometimes you have to trade off because you don't get to select from the best vendors, or products aren't mature enough until they get to certain points. Interesting, because I'm kind of dumbfounded, because I'd imagine in this industry, in the healthcare industry, we would want to apply the best, the latest, to make sure data, all this stuff is leveraged. But you're telling me it's the exact opposite. And again, I don't come from this industry, you do, so I'm kind of just dumbstruck.
Yeah, it is surprising, right? So
it's easy for you. You're like, oh yeah, that's just my normal. That's my normal Monday planning session for me. I'm like, geez, like, okay, well that's interesting. I guess like when you're from the outside, coming in, like when somebody joins your team and they're used to going, hey, I'm going to research. I need to solve this problem. They're like, oh, there's all these vendors, and then you have to say, hey, time out. Sunil's come around now with the bad news that you can't pick half of those vendors because they're not, HIPAA eligible. How do you ramp somebody up to start kind of adjusting to that?
Yeah, so that's an interesting question. So yeah, usually one of the key things that we do while recruiting is try to see if that person has a healthcare background, right? So that way, they come with this idea and they have this knowledge of what they can pick versus what they cannot. But otherwise, it becomes a challenge, right? And then there's usually training that we provide, right? Once somebody's onboarded, and kind of help them think through the first couple of selections and designs, right? So and then once that is done, they kind of understand the complexities and what to look for, right, in a vendor, and then it becomes easier. So yeah, initial ramp up is a little hard. But then once you spend, like, let's say 6 months to a year, right, learning how this thing works and operates, and then you become a pro.
You become a pro. I like that. You've been doing this a while, so for you, it's at secondhand. And I guess when you're kind of looking at, your team and delivery, and knowing that you have to deal with some of these, issues, like you're not as free to make decisions and move at a certain pace. When you guys are looking at potential solutions and you're starting to do the initial planning for those type of new concepts or ideas, do you leave extra time to make sure that you're accounting for potential running into dead ends or not finding the right solution? I mean, I know at this point you've been doing this long enough that you probably can anticipate, but generally speaking, you mentioned the production issue side, you leave 20% capacity, but when you guys are trying to solve something that you haven't come across, how does that impact?
Yeah, so usually we plan ahead, right? I think any of these solutions are well designed, right, and documented even before we enter the execution phase. So the chances of us running into a dead end, I'm not saying that doesn't happen, but the chances of us running into dead ends during the execution of the sprint is it is pretty rare. So I think a key thing to do to avoid running into dead ends is to plan ahead, right, and design very well. Make sure your architecture and design is running at least a sprint ahead. Maybe better if it runs 2 sprints ahead, but at least a sprint ahead. Make sure everybody's on board with the design, understands what we are building, right, understands the edges of the requirements, right. So that would that is how we make sure that we don't run into dead ends during sprint execution.
That makes sense. I mean, it seems like once you're within the space and you understand some of the ramifications, it's old hat. It's pretty much the same as any other team you're running. So I guess I know you've been doing this for a while. Obviously, oncology is a subset of healthcare, even more niche. Transitioning into the industry, if you're from the outside looking in, is there anything you could do to get yourself prepared? Or is it pretty much on the job training?
Yeah, so I'm pretty sure. Like, I wish I knew the answer, right, when I first joined healthcare, because I didn't know. I was like, for the first 6 months, I was kind of lost. I didn't know, like, what folks were talking. Right? They were talking about QI, and like all of these abbreviations. Right? So it was kind of hard, to ramp up. But I think what I could have done better was probably read up a little bit, right, on what was the business, right? What is the business model that the company is operating in? when they talk about treatment, right, what does that mean, right? Maybe just Google it out, right? Understand how a cancer treatment is normally performed, right? What is chemotherapy, what is radiation, right? Understand like what are the supportive care drugs, right? And then understand what is prior authorization, right? What are the stuff that we need to do to be compliant to run the prior authorization business in a compliant manner, right? So look at all of those things. I think those are certain things which are easily available, which are a Google search away, basically, right? So I think search on Google, right, and understand the domain that you want to work in, right? I think that's true not just for healthcare, probably for any domain, right? So just to gain some knowledge, and I think that will help you as you get into newer industries.
Absolutely. Absolutely. I guess, yeah, no, I mean, it seems like you guys are obviously, doing a subset of the, healthcare industry. Oncology is even more specific, even more details, obviously, getting some exposure is interesting. Some of the complexities you mentioned, definitely could imagine it'd be a challenge ramping up, but also it's one of those where, you're helping, towards a bigger cause, bringing solutions. So I think it's amazing, and I appreciate you spending some time kind of going through some of those challenges and managing teams and delivery within the healthcare space, or specifically oncology. So I guess before I let you go, two questions. One is if you had a question or topic you'd like a future technology leader to answer. Is there something specific you'd like to hear about?
Yeah, so it would be really, really interesting to see how folks do CI/CD in their organization, right? And what does that entail, right? That would be really interesting to know.
Absolutely, yeah. I think I need to actually do one covering CI/CD a little bit more. So I think that's a good topic. And secondly, if somebody wants to touch base with you, what's a good way of getting hold of you? Is LinkedIn, email? What's your preferred way?
LinkedIn should be good.
LinkedIn?
Yeah.
Okay. Yeah. We'll make sure we include it in the show notes so that somebody can get in touch with you. But Sunil, thanks for being on. Thanks for sharing.
Yeah, thank you so much, Amir. Thanks for having me.
Absolutely. That's it for this episode. We'll be back again to different topic. Until then, two things. One, I actually need to do more episodes around CI/CD and how different approaches are handled in different companies and kind of different maturity stages. So love to have people on that would like to share. I think that'd be great. And then also, if you found the podcast useful, if you've been listening, share with somebody else. Review on the podcast app of your choice would be fantastic. The podcast has been growing through that means, and I appreciate everyone who does that. Until next time, thank you and goodbye.